So oftentimes we get these questions about extractions in orthodontics. So let's talk about that for a second. So why do we extract in orthodontics? Well, there are several reasons to extract in orthodontics, and one of the misconceptions is that we only extract because of crowding. So actually, that's not the case. A lot of times we extract for crowding if we have to, but we also extract to correct class 2. We extract sometimes to correct proclination. So there's several reasons to extract, and it's not always necessary, but in some cases it is. For example, one thing you have to remember that in orthodontics our goal is to have a nice proportional face as well as have a nice class 1 occlusion, especially class 1 canine. And your diagnostic arch is your lower arch. So if in the lower arch you have too much crowding, you cannot expand the lower arch because there's no suture. The upper arch you can expand, but not the lower arch. Unless you do surgery. Osteodistraction would be the only way to expand the lower arch. Anything else will be just dental tipping, which is really not desirable. So on the lower arch you can't really expand. So if you have too much crowding on the lower arch and you have too much proclination, the teeth are too forward dumped, in some cases the only thing you can do is just extract teeth on the upper arch, and then what you do is you basically make a good lower arch first, and then you make the upper arch match that. In short, the reasons why you would extract a case would be some for crowding, some for class 2, for example, or too much proclination. So there's many reasons, but just remember, one of the biggest misconceptions that we only extract in orthodontics because of crowding. That's not the case. So proclination you can really only diagnose from a ceph, and proclination is how far forward the teeth are dumped out. So if you get too much proclination, that's very unstable, and there's too much stress on the gingiva. And just remember, for example, in crowding, if you have a situation where a patient has, let's say, 8 millimeters of crowding, you can resolve some of that with some stripping, but you can't resolve all of that with just stripping. So if the lower teeth start too proclined already, and you have 8 millimeters of crowding, they're just going to be even more proclined. It's usually 1 millimeter of proclination for each millimeter of crowding. So a case that has 8 millimeters of crowding, you can expect about 4 millimeters of proclination addition to what the patient already has. So hopefully that answers your question about extractions, and if you have any questions, make sure to send us an email.